Hi everybody, my name is Ellie Forsyth and I'm joined today by Aoife Ryan. We are the occupational therapists at the Down Syndrome Centre and we're here to talk about toilet training today. At the end of this webinar, our email addresses will be on the screen, so please don't hesitate to get in touch if you have any queries specific to your child. Step 1, is your child ready? Before you begin, you need to ask yourself this. Starting before a child displays the necessary readiness signs will most likely increase the amount of time it takes for the child to learn this skill. Starting too early can also lead to other problems, such as an increase in undesirable behaviours related to toilet training and high frustration levels in the parent. You also need to ask yourself if you are ready. As a parent, you need to dedicate time and effort to implement an effective toileting programme. If your own schedule does not allow the amount of time needed to take your child to the bathroom on a consistent schedule every day, consider waiting to start until your schedule allows this time. Ensure that everyone working with your child knows that they are being toilet trained. With current COVID-19, lots of us are spending extra time at home, so it might be a good time to do toilet training, but if you're finding it particularly stressful at the moment, you might want to postpone it for a little while. As you can see, there are 10 skills involved in toilet training. They are recognizing that the child needs to go, waiting to eliminate, pulling their pants down, sitting on the toilet, eliminating in the toilet, using toilet paper correctly, pulling pants back up, flushing the toilet, washing hands, drying hands. Each of these steps can be broken down as well considerably. For example, washing hands can be broken into another 5 or 6 steps. So it is quite a complex task that we're undertaking at the moment. Signs that your child are ready to look out for. Age. The child has reached an appropriate age. It is recommended that children with Down syndrome benefit from waiting until after their 3rd birthday to begin the process. Bladder control. The child completely empties his or her bladder and remains dry for at least 1 to 1.5 hours during the day. For a typical child, they may not be ready for toilet training until 3.5. So remember, don't start your child too early. Don't just use age as a consideration. You need to also look out for a predictable stooling pattern, so the child's bowel movements follow a regular and predictable pattern. Motor skills, that your child demonstrates the ability to walk to and from the bathroom independently and to pick up objects. And also consider, are they able to climb up onto the toilet seat by themselves? Behaviour, the child can sit on the toilet or potty comfortably for a couple of minutes. Instructional readiness. This means that the child can follow a few simple directions. For example, sit down, engages in make-believe or imitates actions. So you might want to do some pretend play like putting dollies sitting on the potty. They might also begin to indicate the need to go to the toilet. This might be through something simple as facial expressions, their postures, gestures, or they might be expressing it through pictures or words and indicating that they need to go to the bathroom. And also, it's very important that your child understands what the toilet is used for. And we might talk about this a little bit later, but having an open door policy where your child can observe siblings or yourselves on the toilet will help with this. The second step is monitoring readiness. So it's really important that you take a couple of weeks to do this before you begin toilet training. You want to check that your child's nappy every 30 to 60 minutes. And place a check mark in each of the corresponding time slots the child indicated a need to go. I will show you this, will make more sense now when I show you a chart on how you can document it. And we recommend that you keep the data for 2 weeks. If after 2 weeks the chart shows that your child consistently remained dry for at least 90 minutes and indicated a need to go and displayed a pattern, then they may be ready for toilet training. If in the 2 weeks the data shows the child is not displaying the necessary skills, you can decide to continue taking the data or stop and restart at a later date. So this is an example of a chart that I was talking about. So you just fill in the day and the time every hour or so, and you just want to check if the child is dry, soiled, or wet. And you might even, so some pull-ups are designed now to keep the child really dry. So some of them have like a little strip that turns yellow or blue if they're wet. This might be an indicator for you. Or you might even want to pop in like a piece of tissue or a kitchen towel and check that and see if it's wet. So again, pre-toilet training, it's important to spend a little bit of time doing these activities before you actually begin toilet training. So you want to name urine and bowel movements, spend some time familiarizing your child with the toilet, use consistent language. So decide what you're going to refer to, wee wee, poo poo, whatever it is you decide, use consistent language and make sure everybody working with the child is using the same language. You can sit them on the toilet with and without clothes. Change their nappy as soon as possible because you don't want your child to feel comfortable in a soiled nappy. This can sometimes happen and then they won't indicate when it's time for their nappy to be changed. When they do need a nappy changed, you should try as much as possible to do this in the bathroom environment so they get familiar with toileting is in this room. You can also put underwear on underneath their pull-ups. Again, as I said, pull-ups are designed really well for absorbing lots of liquid and a child doesn't get that sensation of feeling wet. So if you put on regular underwear underneath, they will get that sensation of feeling wet and then will help them to associate the urge to go into the bathroom and actually wetting. You need to decide if you're training to the toilet or potty. We'll talk about this a little bit later on, but there's no right or wrong, you decide yourself. And sometimes the child will kind of naturally veer towards one or the other. As I said, you need to teach them the concept of wet and dry, so you can do this with some water play initially, and then you can start to label it with their nappy when it's wet or when it's dry. And the open door policy. So if you're comfortable, which I would really encourage, that you have an open door policy around toileting in your home so that your child can observe you, siblings, or anybody at home going to the toilet so that they understand that that is the room and what it's used for. So now part 3 is goals. So your initial goal is to get the child to sit on the toilet and teach them to eliminate in the toilet. This is your goal with toilet training. At first you'll need to do all or some of these skills for them, and then later you gradually begin to teach them the other skills that combine up to make a complete toilet training process. So things like washing their hands, pulling their pants up and down, these are all alternative skills, but really the goal at the moment is to eliminate in the toilet. Motivation is very important, as I'm sure you're all well aware at this stage in your child's life. So try and keep toileting fun. Make a positive association with the bathroom and toileting. You could let Teddy have a turn sitting on the toilet and do lots of role play. Put your child sitting on the toilet with the seat down if necessary, and place a mirror in front so they can see the big boy or big girl sitting on the toilet and they get that visual feedback of what it looks like. You can sing songs and read books about toileting while sitting on the toilet, but do reduce this, especially when your child starts to eliminate, because you don't want them to hold until the song or the story is finished before they eliminate into the toilet. And you could also consider using underwear with your child's favorite character on it. So, and then you can teach them, you don't want Mickey Mouse getting wet or something like that, so that they're motivated by the character on their big boy or big girl pants, and that will help them with their toileting and motivation. So rewards is another important thing to consider. So many parents are tempted to use star charts or other reward systems. And some children do need this type of reinforcement. And again, you are the expert when it comes to your child. So whatever works for you. But many children with Down syndrome are highly motivated by praise. This is the most natural and readily available reward and should be your first choice when it comes to rewards. Rewards are important for successful toilet training, so don't forget to reward yourself too. If using rewards, remember they are not bribes. So, and again, be mindful if you're using a toy or something like that as a reward, keep it really short, like limit the amount of time the child has it, and they should only have it in the bathroom area. But again, we do encourage that you try and just use reinforcement and lots of praise as your reward. And then if that's not working, then you could try something additional, like star charts or toys. So the general bathroom routine, you bring your child to the toilet on schedule or when they signal. You pull his or her pants down below their knees. If they can't do it themselves, you can do it for them, but if they can, you want to encourage them to do this. If you're short on time and you're in a bit of a rush to get to the bathroom, maybe do this for them to eliminate any accidents. If their pants are dry, you can encourage them to feel the underpants, and you label that they're dry and give them lots of praise for this. Have them sit on the toilet for a maximum of 1 to 2 minutes. Any longer and the motivation will quickly dwindle. Stay with them to ensure they feel safe and secure. Do lots and lots of eye contact when encouraging your child, and remember, using the same words and gestures every time. If they do eliminate, give them lots of praise. If they don't, bring them from the toilet, bring them back out of the toilet and give them 10 minutes going back to whatever activity they were doing beforehand. And then try again to see if they eliminate this time. So try not to discuss toileting too much during this 10 minutes. Let them just return to whatever they were doing. So you can do lots of toilet talk while in the bathroom, but try not to overdo it while you're in other environments. If they don't eliminate, that's okay. Wait for a signal. Maybe they're asking, or maybe they're making facial expressions or gestures. And if not, just go back to your scheduling time and try it again in the next 90 minutes. Remember to offer regular drinks to increase the opportunity to go to the toilet. So 6 to 8 glasses, ideally a day, will help increase the urine production by the kidneys. And this is essential to develop your child's bladder size. If you're finding it hard to get fluids into your child, look at alternatives like jelly, smoothies, soups, ice pops. Try and increase the fluid intake. And you want to aim to schedule any favorite activities in between your toileting times. So if they want their favorite episode of Peppa Pig and you know that they're due a toilet break in the next 5 minutes, maybe try and push it out so that you're not bringing them away from Peppa to go to the toilet and then creating a negative experience for them. So some bathroom adaptations that we can look at is using maybe a visual schedule or a first and then board. You want to look at the toilet seat, and if your child is a little bit unsteady and has some poor core and balance, you might want to look at an insert or a footstool or a handrail, and you can talk to your OT a little bit more about this if you need a full seating assessment done. Maybe consider using just elasticated trousers, and particularly for the girls, avoid skirts and dresses, because when you're pulling them up, there's lots of excess material there, and it can kind of be a little bit of a hindrance when toileting. As I said, the motivating underwear, so underwear that's got their characters on it, can help. And potty or toilet. So there's kind of a debate. Some people say if you train to the potty, you then have to retrain to the toilet. But then some people find the potty really useful because it can be brought around very easily, and it's the same seat that the child is sitting on no matter what environment. And actually, particularly at the moment, with all the germs and considerations we have to consider, that bringing a potty might actually be a useful thing at the moment. But have a look at your child's signals. They will generally decide for you if they prefer to use the potty or the toilet, and go with that.
Thanks, Ellie. So the next part of this webinar, I'm going to talk to you a little bit about bowel training. So you're going to do similar for what you did originally with the chart, is monitor their elimination pattern. And there's a natural mechanism in the body known as the gastrocolic reflex. And this sends the message to open the bowel, and it is referred as the urge to go. The reflex is triggered by eating food and is particularly strong around 20 to 40 minutes after eating our breakfast, and then again after lunch. So at this time, if you're bringing your child to the toilet, allow them to sit a little bit longer on the toilet, but no more than 5 minutes. And you could use a weight card or a timer if required. So again, you're going to be looking out for signs as well as collecting data, and be aware of signals to learn to recognize them. So such signals you might see with a child would be straining, maybe quietness, redness in the face, or squatting. So be consistent. Your child will come to expect it, and it will be ease. Keep to the schedule, but do not change it. And especially in the first week, try and stick to your schedule of times as much as you possibly can. So again, as what Ellie said earlier on, you're going to try and use the same words as much as possible to make the whole process as predictable and as possible for the child. If they're taken to the toilet in school, make sure that you share the program with the teachers. But as Ellie said, at the moment with COVID-19, lots of people are restricted and not going to many places or seeing many others. But it's really important that if other people are minding the child, that they know exactly the schedule that you've set up. So use a regular toilet from the beginning. So whether that would be your toilet in upstairs, downstairs, or a potty, try and get the child as familiar and as comfortable with the same one. If your child is too small, make the seat a little bit more comfortable by getting an insert or having and a footstool, as Ellie already spoke about in the bathroom adaptations. So observe for constipation. So as many of you may know, that constipation is quite common with children with Down syndrome, and there's many reasons for this. So it could be low tone mobility, celiac disease, underactive thyroid, restricted diets, and lack of or low input of fluids. So you can see from the pictures that when the child is in a squatting position, it's easier for the canal to open and for the bowel movement to happen. So some problems may occur. So if your child does not go to the toilet, remove them from the toilet, and again, try again in 10 minutes. And similar to what Eddie said, when they're doing a bowel movement, what you don't want to do is keep talking about the toilet. Just talk about it when they're in there, but not in between when they need to go or not need to go. This routine avoids frustration and the discomfort of sitting for a long period of time. So any time a child is on their toilet, they should probably be only on for the maximum of 5 minutes, unless they're going. Note that even if they do not eliminate, but they perform part of the task successfully, they should be praised for this. So if they're urinating, but maybe not passing a bowel movement, it's still really important to continue that praise for the urination. Remember, only to discuss the toileting when the child is on it. Use small statements, same words, and reduce your language as much as possible. So wiping. Most children will need assistance for wiping initially, especially when it comes to bowel movements. Gradually fade that physical assistance. And when your child is demonstrating independence, encourage them to go alone. And when they are finished eliminating, then you can assist with cleanup. What might be a good idea is to present to you here is maybe using wet wipes. This way the child gets more feedback and can feel if they're clean by using a wet wipe. Then they could teach them how to tear a few sheets of toilet paper and dry it when they're finished. It's really important that the child stands when they're wiping and wipes from front to back, especially with girls, to reduce infection. So when the child is sitting on the toilet, you want to avoid distracting talk. Talk to your child about what they're doing, what the toilet is for. Avoid talking about unrelated matters such as distracting them with nursery rhymes or food. So what you want to do is when your child is on the toilet, obviously sing and talk away about toileting or the bathroom, but try and avoid using distraction nursery rhymes, as they may wait until the nursery rhyme is finished and want you to be there to finish the nursery rhyme with them. Teach your child that they are there for one reason, and that is to eliminate in the toilet. It's not a playground and it's not a time for fun, it's just a time for eliminating. So remove all toys and games from the bathroom. So phasing yourself out of the bathroom. So your child needs to get really comfortable in the bathroom and being able to eliminate, and then you want them to get used to being in the bathroom by themselves. So you should try and do this as soon as your child feels safe in the toilet on their own. So you need to stay with them and gradually, really gradually move away. So pretend that maybe you're attending to something in the other side of the bathroom or standing in the doorway. Eventually, slide outside the door just a little bit and then move away as you feel the child is more comfortable. Continue to praise the child at all times when they're successful in the bathroom. When they're eliminating in the toilet, begin to phase out rewards like you would do with teaching any new skill, and you would reduce it to praise, and eventually they become fully independent. At all times, you should try and keep records, determining when the child is going to the toilet and at the right times, and going off the schedule that you would have produced earlier on and your time slots. It's really important to know that when you have established that the child is eliminating, whether it's urinating or bowel movement at certain times, that's when you'll determine when your child, that when their schedule is for ready for going. Stay on the schedule for at least a week before you try and extend it out, and count the number of bowel movements your child has in their nappy and in the toilet. By all means, you want your child to be successful, but accidents will happen, and especially at the start. So what you want to do is remove maybe expensive rugs, put some old throws on couches, especially at the beginning. When a child has an accident, you want to avoid fuss or avoid any negative talk, as this is going to be upsetting and embarrassing for the child. Deal with them discreetly and quietly, but please don't get angry, and teach them that their bodily functions are bad. It has to be a really positive experience for the child to increase this behavior of happening again. Where possible, have the child change their clothes themselves. If they need assistance, assist them, but have them, be aware of why they're changing the clothes. If their clothes are wet and need to put on new clothes. Bring their attention to it by feeling wet, and maybe, you're labeling that they're wet and that's why they need to change. If they have a bowel movement or soil their pants, it's a good idea to bring it to the toilet and flush it into the toilet. And it's important that when you're cleaning them, that you use the bathroom for cleaning, and trying to reinforce the idea that this is why we're in the toilet. Avoid cuddling or engaging in any type of cheerful conversation, because what you don't want to do is try and reassure them too much that they realize that they get lots of attention. This may increase the behavior of a child soiling or wetting themselves if they get lots of attention for that. Think about maybe what caused the accident. Was the schedule pushed too far out? Did you forget to remind them? Was it a different environment? Maybe the child wasn't feeling well, or maybe they were frightened, or maybe they were doing something that was during their favorite thing to do. As Ellie said earlier, if they're watching Peppa Pig, try and schedule it that's not on at the time, because it's very difficult to try and take a child away from that, or they're very distracted by their favorite program. Nighttime training. So after about 1 or 2 months of successful daytime training, it's time to move on to night training. Sometimes, for some children, this automatically just happens. For other children, we need to teach them this part as well. So limit your child's influence of fluids up to 45 minutes before bedtime, and avoid soft drinks and juices for 2 hours before bedtime. Take your child to the bathroom 45 minutes before bedtime, then again at bedtime, and if possible, do another toilet before you go to bed. Try and avoid putting on any lights, maybe use a night light if possible. Remove toys, books, and other distractions that could become an alternative to going back to bed. So remember, is your child ready for toileting? Can they follow simple directions? Can they sit in a chair for up to 5 minutes? Can they wait for at least 1.5 hours between elimination times? If your child can follow simple directions, sitting for 5 minutes, concentrate on teaching this skill. Stick to the approach that you need to be consistent. You may need to enlist the help of other people that are in the house at the moment. And likewise, when they go to school, that these other people will be willing to engage in teaching this new skill. So the usual sequence is urinary continence, bowel control, and then nighttime control. This isn't a set rule. Sometimes children will move from one to the other much easier, and sometimes things will automatically happen for a child. If you have any questions, please get in contact with Ellie or myself at our email addresses as ellie@downsyndromecentre.ie and aoife@downsyndromecentre.ie. Please keep it going. It's a great time to try and do the toileting if you're at home and school is coming to an end for some of maybe some siblings, so you have more time in your hands. But if it's not a good time, don't stress yourself out and try and do something that maybe you're not going to have time to do. We wish you the best of luck with it, and please get in touch if you want any help. Thank you.